as a dental hygienist, you must get so excited when you clean that mouth, get it nice and healthy, and make us walk out the door with that big smile.
I get very excited. I think that's why I do my job, is because I'm a tooth picker and I love it, and I just love to be clean. So
I think that it's very important. That is, one of the most first things I guess people see is your smile. And when you are embarrassed to smile, how sad is that?
it's very sad. And most people won't. They decide not to, and so it's very sad.
Yeah, well, you have beautiful smile, beautiful teeth, and here at Dr. Cheney's office, there's a great team here, and you have state-of-the-art equipment that help you do that process. If I am flossing and I'm bleeding in my gums, that's a sign of you better get in and get something done?
Right. Whenever you see bleeding, it is a sign of you have bacteria in your gums, and that you need to come in and get them cleaned, so that you can have overall good oral health and overall good oral or general health as well.
I think it's a common problem. I think people bleed quite often. They think, oh, it's in my mouth, I don't have to worry about it. And I know with even teenagers and kids that aren't flossing every day, you'll see that quite often.
Yes, and I regularly get the same comment over and over again. No big deal. I bleed all the time. It's no big deal. And I want to just say, yes, it is. It's a big deal.
It is a big deal.
It's in your mouth.
Well, see, I never equated that as being such a huge deal either. But you had, before we started filming, she was saying you can compare it to a deck of a card size cut on your arm.
And if you had that on your arm, would you not say, hey, I'm going to the emergency room right now? That's the same as in your mouth.
Okay.
But you can't see in your mouth, so most people just brush it off and...
Yep. Okay, so let's talk about that. If you are having bleeding issues, need to come in here, have your teeth checked, your gums checked. You can clean it, and then what?
First, we encourage you to come in, have your gums cleaned, and after the cleaning, what I recommend is every time I do see bleeding, to have a laser treatment done.
And this is a new technology that I'm not aware of.
It's fairly new. In fact, just within, I think, the 25 years that it's kind of slowly started coming more popular, but...
And becoming into the dental offices right here. So you're one of the few I know in the Valley that actually has this technology, and let's talk about it because it actually goes a little deeper in getting rid of that bacteria than what you can even do.
Right. Even as hygienists, we can scale and scale and scale, and there will still be bacteria, in the gum tissue. And what this laser does, which I love, 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 is that it has the ability to use its energy to penetrate into that soft tissue, the gum or your gums, and kill the bacteria.
And that's going to help heal the gums, and they won't bleed anymore.
Exactly. Fantastic. Along with that, it kills the bacteria. It will help promote the healing and the repair of the tissue as well. So
isn't that interesting? Yeah, so you're actually healing and then helping with the repair. And how often would you need to do this if you are in the bleeding gums? Is it something that's going to take a couple sessions, 5 or 6?
Well, I would say to that comment, it depends on how well you do with your home care. And so we always give instructions of how, that your regular flossing, your regular brushing, even rinsing with Listerine for a good 30 seconds each night will make this as best as it can be.
It always does come down to you've got to take care of your mouth. Exactly. And so if you aren't in that habit of flossing every day, get into that habit. Yes. But even after you come here and get cleaned, right, you need to keep up with that.
You do. But it's always... whenever I see bleeding, again, I can use it and it will kill the bacteria. But of course, it's up to the patient when they leave this office to do that. Keep the bacteria away.
Well, I floss all the time. I don't have bleeding gums, but I want that done to me anyway.
Well, yes.
I know that all that germs are going away.
Yes, you do. I mean, it's got many benefits to that, so.
Yeah, okay. And cost effective, is it going to cost me a lot to do that?
No, in fact, that's why I love using this, is because before, all we could do really is use an antibiotic to place in the gums, and that was really expensive. It was, for each tooth, you could place an antibiotic 6 times, and that's 6 times 32. That is expensive. Right. $50. 6 times, yeah, it would get up into the hundreds. And so...
And this cost is?
This is $35
For the whole
for
mouth.
the whole mouth.
Yeah, so it's so worth coming in and finding out. First of all, have Melissa take care of your mouth.
Right.
And then step forward with this.
Exactly.
as needed. And I suppose you just work with the patient and tell them when this is an option for them.
Yep, I do. And so,
Fantastic. Well, right here at Dr. Cheney's office, you guys are so great. I love that you're so thinking forward, ahead of the game, and taking care of our mouths.
well, and also with this is, other than just keeping the bacteria away, it also will help desensitize sensitive teeth, which many people have, and it will also help get rid of cold sores.
So glad you mentioned that, because I do have very sensitive teeth, and that will help with that.
Yes, it will.
Oh, love it. Right here at Dr. Cheney's office. Give him a call today and come on in. Thanks so much.